Hey, it's Dr. Lindsay Monroe with Ideal Human. Today we're going to be talking about sources of inflammation. So inflammation is kind of a buzzword. We hear it thrown around a lot. And so I want to clear up a few things about that first. The first thing is that inflammation comes from your immune system. All inflammation in your body is part of that immune system trying to do its job. So the second thing I want to clear up is not all inflammation is bad. So inflammation is part of a healing process. Like everybody thinks about, okay, you sprain your ankle, it gets swollen, it gets hot, it gets red. That's good inflammation. That's your body trying to get blood and resources to an area that's acutely damaged and needs that repair. Now where inflammation is an issue is when you have chronic inflammation. This is that person who has no joint injury per se, but they have a history of a lot of joint pain. Oh, my knees always kind of ache, my fingers kind of ache. This can also be things like brain fog or frequent headaches. This could be pain or bloating in your intestines. So there's lots of different ways that inflammation manifests. However, because all inflammation comes from the immune system, the easiest way to rule out causes of inflammation is to start where the immune system lives, which is in the gut. 80% of your immune system resides in the intestines, and so we go there to look for the most obvious sources of inflammation. And of course, that brings us to your diet, right? That's really what fills your intestines, is your food. So there's the bacteria in your gut that can cause inflammation and interact with the immune system, and there's what you're eating that can interact with the immune system and cause inflammation. And so it's really important to look at different aspects of the immune system and look at how they're interacting with the foods you eat to understand if these things, like, they could be healthy foods too, something like broccoli or chicken that you eat all the time, if those are actually sources of inflammation, and that most healthy diets would never ask you to avoid. And so you won't just stumble upon these things and figure out that you're sensitive to chicken or broccoli or spinach just by following a conventionally healthy diet. So the way I investigate this is I use a food sensitivity panel, or a dietary antigen test is another way to say it, and that's going to look at multiple different branches of the immune system. So I want to break that down for you guys, show you what it looks like, and kind of why sometimes food allergies or food sensitivities can be really hard to get a handle on, but hopefully we'll give you a better idea of how it impacts your body. Okay, you guys, so here's the example of what this dietary antigen test looks like. So just for the record, an antigen is a little protein strand, and proteins are made of amino acids, and so this is several amino acids together. And that our immune system can create a reaction to. So the way our immune system creates that reaction is by making something called antibodies. Antibodies are shaped like Ys, and they go through, they circulate in our blood, and they tag things for disposal. And so when we eat food, technically it really shouldn't be making it into our bloodstream, but occasionally things do. Or if we have something called increased intestinal permeability, aka leaky gut, you will see more food particles making it to the bloodstream. Or if you have very poor digestive function, if you don't have enough enzymes or enough stomach acid or enough bile, more things, more antigens or more little bits of protein from the food are going to make it into your bloodstream. So when we look at this test, you'll see a whole bunch up here, but we're going to divide it kind of in half right here. This part right here is your allergies. This over here is your sensitivities. What's the difference? They're different parts of your immune system reaction. So allergies, we have an antibody class called IgE. Ig stands for immunoglobulin, the E stands for the type. So I don't know why they got letters instead of numbers, but that's the way it is. These are your classic allergies. You eat food and you get itchy eyes, a runny nose, postnasal drip, you keep clearing your throat, all those classic allergy symptoms. This is a very fast acting part of the immune system, and the more you eat these foods that you have an IgE response to, the more your response is going to ramp up. So your allergy is going to get worse and worse. So it might start very subtly, and then it's going to get worse over time, and you react quickly as well. You're going to react within 30 minutes to a few hours. It's a very fast response. The main thing that drives this reaction is called histamine. Histamine is what makes your skin turn red and itchy when you get a rash, for instance, and it drives all those other allergy responses. You can see with this patient, cauliflower, which is a perfectly normal, healthy food, is one of their high allergens. Another one, this one's very common down here, is egg albumin. That's the egg white. And they have a moderate response to that. And so this patient does have a few allergies that come up. Now, that's not the whole picture. Our body knows that when we eat food, we need to tolerate that food. And so it very cleverly makes this type of antibody here, this IgG4. So let's break this down. Ig here stands for immunoglobulin, the G stands for the antibody class, and the 4 is the subtype. And so IgG is a big class, and there's 4 different types of antibodies within that class. This is the 4th one. This is separated out from all the other IgG antibodies because it has a unique role. Its job is to block the IgE antibodies from triggering a histamine release. And so these are actually a good thing, and they promote food tolerance. And so when we look at this person's panel, we see that they're promoting a goodly amount of tolerance here in many different items. And so there are things that came up. Let's see if they have any examples of that. So for instance here, soybeans. This is something that that person is highly allergic to, but they're also doing a pretty darn good job of blocking out those soybean antibodies, the IgE type, and so they might actually not respond very much to soybean at all because their body has created tolerance. And that's what that IgG4 antibody does. As we move over, now we're getting to the other class of immune response. This is called your sensitivity. This IgG antibody type here, this is what's causing those sensitivities. This is a very slow reaction. It can take up to 3 days to fully feel the effects of an IgG response. These tend to be a little bit more systemic symptoms as well. It could be a headache, it could be joint pain, it could be stomach pain, brain fog, fatigue. They're very varied in how people respond. I think it really depends on the person's unique biology, but that's gonna be really hard to track down. If you eat something on Monday and it's Thursday and you're feeling poorly, very few of us think back to Monday and try to track down, well, what did I do differently with my diet? So you can see with this patient, they do have several sensitivities that are ticked here. So for instance, they respond to yeast, which could be an indication of actually yeast overgrowth in the intestines, casein, which is a milk protein, cashew, and so forth. So the last column here then is an amplifying molecule. This is another part of our immune system called complement, and it's actually a complement cascade, and so there's many different things that are a part of that, but this one called C3d, this makes anything that's going on in the IgG more, it intensifies it. And so, and I don't think this patient has any complement, but let's say that they had a reaction right here. Let's say this was complement positive, and so this was candida, and so they have moderate amounts of IgG antibodies to candida, but with complement being positive, they would actually be reacting much more strongly. It'd be more like a high amount, and so this would be something that really could be causing them to be symptomatic. And so that's kind of the breakdown of what our immune system is doing. So we have here, we've got our allergies over here, we've got our sensitivities over here, and now when we put both of these together, we can get a much better idea of what foods are going to be very aggravating for this person. So as we go down the list, we can see again, we've got coconut here. They have a high IgG4 response and a high IG, or a moderate IgG total response. And so this is a food that might be kind of noxious for that person. And we just go down the line and see which foods we should pull out. This saves you a lot of time because now you don't have to guess what's going on in your body. You can see all the things that you could be creating an antibody to, and we remove those and allow the body to calm down while you work on healing your gut and working on making sure that your intestines are really healthy. And then once that's done, you reintroduce these foods, and you start with the ones that you had the lowest reaction to. You reintroduce those first, and then you keep working towards the ones that you had stronger and stronger responses. And normally what you see happen is once you remove those foods for several months, you are able to tolerate them much, much better, and now you can eat them without any symptoms. Okay, so now you can see when we remove those foods that you're reacting to, you take a break from them for 3 to 6 months, and you work on healing your intestines, making sure that they're nice and healthy. You can reintroduce those foods. And our immune system is dynamic, and so if it's not seeing a food that it used to react to, it stops making the antibodies. And so what that means is when you reintroduce that food, you no longer have an immune response to it, and so you can tolerate it much, much better, and you can eat that food without any symptoms. And so that's one of the best ways to, first of all, discover what's inflaming your body, and secondly, to make sure that you do everything you can to decrease that inflammation to improve your overall health.